I was at Becker's and talked to a number of different CEOs, and they range from saying, we have to be on the cutting edge. We have to be nimble and able to respond, which I believe, to other ones saying this is a fad. I've seen fads before. And I think those healthcare providers and those healthcare insurers are going to have a tough time.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 418. Today, we have the Flava of the Week about Oura's newly released meals and glucose product features. What new health tracking possibilities do these features unlock for consumers, and what's next from the world of modern wearables? I'll talk about that. Then Zane and I have an exclusive conversation with Dr. Marschall Runge, CEO of Michigan Medicine and Dean of the Medical School at the University of Michigan, where he shares his remarkable perspective on how technology advances, policy changes, and emerging business models are fundamentally transforming the industry. He shares this and a lot more from his brand new book, The Great Healthcare Disruption. Where else are you going to get this perspective, folks? It's time for the awesomeness. Are you ready? Let's go.
Flava of the Week.
Oura's latest product features feel truly transformative. If connected fitness really is a big part of the future of health like we keep saying, you can bet we're paying a lot of attention to Oura's announcement about its meals and glucose features. They posted the following on LinkedIn on May 6th. We're expanding the Oura experience with a new focus on metabolic health, introducing deeper insights into how the body responds to everyday choices, now including what you eat. With the launch of 2 new metabolic health features, meals and glucose, Oura connects nutritional and biometric data, helping members better understand the relationship between food, activity, sleep, stress, glucose, and more in real time. The Meals feature simplifies food tracking with photo-based logging and AI-driven insights, offering more than just nutritional information. It helps members understand how the composition of each meal may influence energy levels, cravings, and physiological balance throughout the day. Through Oura's integration with Stelo by Dexcom, the first FDA-cleared over-the-counter glucose biosensor, the glucose feature brings continuous glucose data into the app for the first time, all in the context of daily health behaviors. So members can now observe how their glucose levels respond to their habits, uncover patterns, and make more informed decisions. These new features reflect a commitment to supporting proactive, personalized health, empowering members with meaningful context about how their bodies function and adapt. Both features will be rolled out to all US Oura members by May 13th, so not a coincidence that we're talking about it today, y'all. You'll recall how long we've spent on this show inviting hospital and health system leaders to design and market services that are more consumer-centered. We'll continue to do so because that's an important part of the healthcare journey. At the same time, it feels like we have a lot more control and therefore engage more with wearables and other smart devices that are pushing the boundaries of what we can know about ourselves without a doctor's visit. And that's important because who's in charge of your health? You know the answer here. You are. Now, we talk a lot on this show about how that's been a challenge in a world where historically there weren't options to prevent or monitor disease with a smart ring or learn how your meal affects your glucose in real time by just taking a picture of what you're eating. We get that. With features like this, though, we are truly in a new world, and that world is only getting smarter by the day and more capable of delivering insights into our health and wellness. I, for one, can't wait to see what's next. Let's explore the frontiers of what Oura and other consumer devices are offering to us, knowing that individual-based innovations are only going to get more sophisticated from here. That's another way that we'll build the healthcare of tomorrow. And that's the Flava of the Week. Shed is revolutionizing health and wellness by making wellness available to everyone. Through personalized nutrition, high-quality supplements, and science-backed wellness strategies, Shed empowers individuals to take control of their health and live longer, healthier lives. Not sure where to start? Try NAD+, the ultimate coenzyme that supports cells, DNA repair, and anti-aging. Or maybe you'll like LDN for managing chronic pain, autoimmune diseases, and metabolic health challenges. Visit Try Shed to start your wellness journey today. That's tryshed.com. Let's do this today, Zane. I'm really excited because this is one of those rare opportunities for us to really dig into someone who's not only on the ground every day, but is a leader and is offering us a vision of where to go with things. So before we welcome Dr. Runge on here, I'm just curious what you hope to get out of our interview with him.
Well, I'm personally excited since at the University of Michigan, where Dr. Runge works, or leads, is close to home. It's about 45 minutes from where I live. And having been a former employee of a competing health system, so to speak, I'm pretty aware of some of the innovations they're doing in Michigan and the state and really in the region. And with my background, even formerly living in Canada, I know sometimes there's patients from Southern Ontario that go to the University of Michigan. And so really excited to be interviewing someone who comes from truly a leading academic medical center within this region, and who's also an author on topics that we love to talk about. And so I'm hoping to get a lot out of this interview.
Fantastic. All right. Well, let's welcome in our guest today. With us is Dr. Marschall Runge. He's a CEO of Michigan Medicine and the Dean of the Medical School at the University of Michigan. Dr. Runge, it's a pleasure to have you with us.
Great to be here. Thanks for having me on your show.
There's a lot that's publicized about your background. We always like to ask, is there something that maybe our listeners might not know about you or your background that's kind of fun to share?
I'm a cardiologist and have been in healthcare for 40 years, almost 40 years after training. And I learn every year. And one of the things that has been a big surprise to me that people won't know, they might know if they read The Great Healthcare Disruption, is that even though I'm a specialist, I've grown to really appreciate the importance of primary care. And in two different settings. One is there are clinics called federally qualified health centers. And there are three in Ypsilanti, and there's several more in Detroit. And the other experience, so I've worked at one of those, not recently, but I worked when I was in North Carolina. I went to one of those half a day every other week for 15 years. And then last summer, I had a chance to do something I'd always wanted to do and I never had done, which was to go to one of the public health service health sites as part of the Indian Health Service. And so I had the opportunity to go to Shiprock, New Mexico, and that's on the Navajo Nation. They care for 99% of their population are tribal members. And I have to tell you, both of those settings, and this is what I wanted to say that people might not know about me, I am so impressed with the dedication of the healthcare providers, the doctors, the nurses, the therapists, and they really form what's called a medical home, such that it's one-stop shopping, access is great. And so all the things that I talk about in the book and think about every day at Michigan Medicine that we need to improve in, they do very well. And in fact, I told friends and relatives after I came back from Shiprock last summer, it had totally restored my confidence that we can do great things in healthcare in the United States.
Well, that's wonderful. Typically, some of the guests we come on here come with a bit of a pessimistic or dystopian view of the future of health. And so it's wonderful to hear, first of all, that a cardiologist and someone who's leading a significant health system in the country feels that way. It's encouraging. I'm curious, Marschall, could you give our listeners, so most people listening are from all over the U.S., some Canadians listen as well. Could you just give a profile of Michigan Medicine, your role, just in case people aren't fully aware of the breadth and depth of the organization and what it means to Michigan and the region?
Michigan Medicine is a large health system. I came 10 years ago, and in the structure, my position included oversight of the entire health system, plus a university role, plus being dean of the medical school. So what I found most attractive about that was it was all integrated. Sometimes health systems and medical schools are tangling about money. And of course, we have to watch out for money issues as well. But at least we're all have the same purpose. And our purpose is to improve health. And improve health sometimes means with critically ill patients. Sometimes it means being in the community and improving the health of people so they don't have to come to the hospital. So when I came, Michigan Medicine, which is both medical school and the health system together, had an annual budget of about $3.5 billion. That's a lot. We'll close out this year with an annual budget of exceeding $8 billion. So we've grown quite a lot in the last 10 years. And part of the reason we have done that is we get patients from every county in the state of Michigan and some in Ohio, some folks from Canada, some folks from all over the world. And our goal in forming a network, so now we have major locations in Lansing and 5 surrounding hospitals that were part of Sparrow Health System and in Grand Rapids. And then we have affiliations all over the state. But what we strive to do is we want people to get the best health care where they live. So if they can get the highest quality health care where they are with their friends or family around, and So when they go back home, they can have continuity there. That's what we want to do. And the health systems that we have joined with or have joined with us are high quality anyway, but we've been able to bring services that they didn't have. Cardiac surgery in Grand Rapids at what used to be the Metro Health System, neurosurgery at Sparrow Health in Lansing, but a total of about 250 services across this network, new services. And it's a great collaboration. And they are outstanding community hospitals. We are, I believe, an outstanding academic health center, and it's very complementary. That's our goal.
Would love to know, as a avid reader of Crane's Detroit Business, I see the headlines that y'all are making. And so a couple months ago, or it wasn't a couple months ago, a while ago actually, y'all made an announcement that you're investing north of the city by the Somerset Mall, building a big development there. And then also as reading that the University of Michigan, and unsure if there's a health component, is building an innovation center downtown. And so would love to hear about what the spirit of those two projects are and what the consumer transformation in health might lead to thanks to those investments.
I'll start at Troy. So we have a large number of alums who live in that part of Detroit, those suburbs, and also that often come to Ann Arbor for their health care and is where you live. That can be an easy drive, or that can not be an easy drive. And so we wanted to be able to provide care close to their homes. And so that's the goal of our specialty center, which will be actually right adjacent to the Somerset Mall, where the old world headquarters of Kmart were. And this will have several areas of focus. One is oncology, and people who are cancer patients will be able to receive their chemotherapy treatments there. Another is cardiovascular disease. We have a large cardiovascular center, and it will have a component there in Troy. And a final area, and there are other areas, but a final area that I think is really exciting has to do with sports medicine. So we're very excited about that program, and I think that all programs there, I think, will be a real benefit to the community, much closer to their homes, and they're really we'll send the highest quality physicians we have there.
That's fantastic. Well, I know when I saw the press release go out in my head, I'm like, wow, that's like an A+ location. So many locals go there anyway to eat or shop. Might as well get your health care right down the street there too. So congrats on securing that.
Thanks.
I wanted to ask you, Marschall, a few months ago, and obviously we're big fans of consumer tech here on the Healthcare Wrap podcast. We actually have the lovely team, the CTO of Zipline, the drone delivery company, on the show. And we had a lovely chat with them about their technology. And on that episode, they disclosed that they're working with the University of Michigan. And so I presume that's you and your team. And so would love to hear about it, and would particularly love to know if I'm going to see drones flying by my condo downtown, and will there be a big University of Michigan logo on them?
Well, we're starting the program not with a big bang, not all everywhere, to make sure that we've got it right. Your listeners know from that show, this was a great idea. And I can say that because we didn't come up with this idea, but we were fortunate to collaborate and join forces with Zipline. And I think this is important for many, many people. So what Zipline can do is to deliver medications right to your home. And it has geolocation. It has all kinds of safety features. And the drone will be there. The medication will come down and the person picks it up. And so the technology allows the drone pilot to be sure that the person's there, be sure it's the right person. If it's a controlled substance, be sure that that's done properly. And initially, we have a lot of older patients who have trouble getting back and forth from the pharmacy or back and forth from the clinics. And we thought it would be a great benefit for them. But now we're learning that it's not just a benefit for people who have some challenges with mobility. It's a benefit to everybody. It's, in a sense, it's like having Amazon come to your doorstep. But it's more sophisticated than that because the range of medications that can be brought are immense. The time that it takes to get it is 20 minutes at most. And man, it's green. What more could you ask? I mean, there's basically no carbon footprint from drones compared to previously we were delivering these drugs in cars. And so it was both took longer, more expensive actually to do it in cars than it is with Zipline. So I'm glad you asked about that, Zane, because that is an example, one of many, of how technology can really have an impact in healthcare.
And genuinely, kudos to you all at the University of Michigan. So Jared and I, in our day jobs, we're digital health transformation advisors and consultants in patient experience. And on the drone delivery in particular, we still see a lot of health systems lagging in that space. They don't think it's a real technology yet. They don't quite understand what's capable. And frankly, they say things like, well, it doesn't really improve quality of care. And I could see why they'd say that. But what we always argue is, hey, if Amazon's delivering their products with it or Walmart, at some point consumers will want it delivered that way, and you just need to do it. And so kudos to you all for at least, I think, being, as far as I'm aware, the first in Michigan to launch this. So congratulations.
We are. I think there was a health system in Arkansas that actually was the very first to launch it.
Momentum's the word that just kept coming to mind with all the things you've just been describing, Marschall. And part of that momentum here is I'm really happy to share about, we're here to talk about your new book called, the title is The Great Healthcare Disruption. And the subtitle is Big Tech, Bold Policy, and the Future of American Medicine. Got a copy of it right here. Super happy to dive into this. And as usual, there's always a story behind the book. There's always the story behind the story that we don't usually hear about as much. What led up to this? There's so many areas of disruption in healthcare today. This book, some of the key areas that it talks about are technological advances, policy changes, and emerging business models. So would love to hear just background of the book, how you got to this stage and kind of how you decided to focus on those areas.
Well, it's been a great project, a lot of fun to work on. I've learned a lot and dispelled some misperceptions I had once I learned more about things. But a little more than a year ago, Forbes Books contacted me and asked if I wanted to work with them on a book. And Forbes Books does a range of books, but generally they're authored by CEOs in one area or another, not at all exclusive to healthcare. And so I said, well, that sounds really exciting. What would you like me to write about? And this is the best part. They said, whatever you want. And so they had a team that we talked about it, worked on it, and we thought that actually something that I think will impact healthcare dramatically in the next 5 years, much less 10 years, is technology. And so how can technology disrupt some of the things that we do? And when I say disrupt, I mean it in a very positive way. So we all know some of the problems in healthcare. It's frightfully expensive. It's hard to schedule appointments. So I'll ask both of you, do you ever have trouble getting in to see your doctor when you want to see your doctor? If you don't, that's unusual.
Yeah. I mean, it's not usually, luckily where I get my care, the digital experience is great. Like I can actually book the appointment, but it's just far out. And so the access piece is hard.
Exactly. Part of the book talks about access. How can we improve access? So access is a problem across the United States for a lot of different reasons. It's a problem because as the baby boom population, which I'm part of, has aged, the need for healthcare has dramatically increased, and also the technology that's available. So we're able to provide really great quality care, but it doesn't help people if they're going to have to wait 2 or 3 or 4 or 6 weeks, depending on the specialty. So I was asking myself, is there a way we can use technology? And then you said part of it is you can schedule your own appointments, but it's still a wait. And how can we incorporate emerging technologies like AI, which I think is going to be totally transformational in healthcare in a very positive way? How can we incorporate that into the patient experience? And again, as I said when I started, our goal is to focus all of our efforts on providing our patients the best healthcare and the best experience that they can have. And so, if you don't mind, I'll veer into AI for just a couple of minutes. About a month ago, I spoke at a technology conference in Detroit called SIM. I don't know if it's SIM, S-I-M.
No, and I'm ashamed I wasn't there.
It's a fantastic group. And so I had, 250 people, and they were all IT experts, but very interested in healthcare. So not only could I tell them what we're thinking about, but they told me what they were thinking about. Really engaging conversation. So let's think about how AI might be helpful. So one of the big problems for physicians and nurses and all healthcare providers is the documentation part of it. So you have an encounter. If you've been to a physician or a nurse or provider recently, you may have had times when they were looking at their computer typing away because they're trying to keep up. And so we have started using a technology called ambient AI. Ambient AI incorporates the conversation, but then it doesn't just give a transcript. It's a top quality medical record note that's much more concise than what generally we do. That's at one level. At another level, Michigan started this experiment where they provided an AI tutor for undergrads and anybody who wanted one. And the idea was that it could go out and if you missed a lecture or don't you want to get the materials, it could bring those to you. But what it was also capable of was machine learning. And so I don't know about both of you, but for me, I learn best in answering test questions. I don't learn best in listening to lectures. I don't learn best necessarily in reading thick textbooks, but everybody's different. And so it can do some testing for the student and let them test themselves. And when it figures out how they learn best, help them learn in that environment. So how is that relevant to healthcare? Well, imagine if we could have AI assistance for physicians or for patients. So we're actively looking into that because I think the technology is there. I don't want people to believe, I don't believe that AI is going to replace healthcare providers, but I think AI is going to augment them. And I think it's a really exciting time. You probably heard, since you're both into technology, this term Promethean moment. So it's from the Greek god Prometheus or something, but it's to describe a time when change is so rapid, it makes things almost irrelevant that happened before. And that's been used to describe AI in lots of different settings. And I think it has great potential in healthcare. So if it was what are we doing that we think will be transformational? That's part of it. The other part is we're actively working with communities to help our medical students become more engaged in primary care. And we always wonder, why don't we have enough primary care doctors? In fact, if you compare us to most of our peer nations, our peer wealthy nations, their number of primary care providers is much higher than ours. Ours is really low. And on the other hand, if you look at the cost of healthcare, our cost is really high and their cost is lower. And I think a lot of that has to do with access to primary care and health. And we think that one of the ways that we can help Americans the most is to help them improve their health so they don't have to come to the hospital, so they don't have to have an expensive or dangerous procedure. And one of the messages I want to continue to comment on during this interview is we want people to take charge of their own health. I want people to take charge of our own health. And in doing so, I think that engages you. Nobody can be healthy all the time. And some people have predispositions to certain diseases, but if they take charge of it, that makes a big difference.
And that's music to our ears. Here on the Healthcare app, we've been chatting about moving care upstream since day one. On our predictions episode, Marschall, we made the prediction that connected fitness will likely be the future of digital health, which is starting to turn out to be true. Wanted to ask you, and so love everything you've been saying so far about AI and how y'all are working with primary care, but curious, tactically, what does this look like at Michigan Medicine? I presume you have a team of people that are working on this for you. And have you all put together a digital transformation strategy or consumer strategy? How has this all been shaped so that you all can execute on it at Michigan Medicine?
We have a great digital technology group at Michigan Medicine, and they're doing all kinds of interesting work. I'll tell you what the biggest challenge is for us. We need to figure out where are the places where we need to build it ourselves versus where we need to take something that's out there and incorporate it. And surprisingly, well, it's a surprise to me. Maybe it shouldn't be a surprise. There is so much activity in AI in healthcare that we believe most of what we need, we can bring in from anywhere from startups to very sophisticated companies. Last week there's an organization called Becker's Healthcare, and they hold meetings in Chicago, and I went and spoke at a couple of panels there. And the number of people that I met in 3 days who are really doing some great stuff with digital technology is amazing. And they come up and say, well, let's talk about what you're doing at Michigan Medicine in this area or that area. And they have some great technology.
I can tell you with 100% certainty, that's the work that Jared and I do for a living. And there's definitely a myriad of solutions out there that you all could partner with. And maybe we'll have to chat on.
We'll have to have another conversation when you give me an idea of what we could do. And I think one thing that's a challenge in big health systems like ours, and also in academic health systems, is there's a certain resistance to change. And one way I've heard it described of these new entrants into healthcare, whether it's Amazon Clinic for 24/7 access or Zipline or whatever it is that entrepreneurs have come up and tech experts have come up with the idea of, well, let's try to find out where the pressure point is. Where do people really need help? And then develop technology for that. And I think it's terrific. And so what I've tried to do is make sure we learn about and embrace technological advances.
100% agree. And then also thinking about it from the lens of what is actually important to the health consumer. And I say consumer on purpose, and making healthcare where it makes sense. Feel a lot more like procuring a product or service from Amazon or Walmart and having some of those familiar digitally enabled retail experiences to make particularly low acuity care a lot more easy to access. That's how I would look at it.
I look at it the same way. I do have one area, so you guys are tech experts, where I think we need to figure out a solution. And that is in terms of interoperability of healthcare records.
Yep.
Let's say you are feeling really bad, you call up Amazon Health and at 2 a.m. And that encounter, unless you're really very cognizant of what you have had, they may not learn about something that you've had that's highly relevant to your current symptoms. Or when you go back and see your primary care provider, they won't have any record of what you did with Amazon. You'll have to tell them about that. And that leads to a level of fragmentation that can both be unnecessary, but also can even be a danger. I saw an advertisement for, I don't remember if it was Amazon or who it was, but if you got on a plane and felt like you had a urinary tract infection, you could contact via text Amazon Clinic and the prescription could be waiting for you when you get off the plane. Well, that's a fine idea. The question is, how much information do they need to do to be sure that you don't have something else going on in your health or in your medical care that might cause either that approach not to work or even worse, to conflict with a medication you're taking or a condition that you have. So I think there's a lot to be learned here. I think it's great, but a lot to be learned.
I think that's a fair point, and I'll make a comment, and I know Jared had a question, but what I've observed is that there's a lot of these direct-to-consumer virtual care solutions out there that are essentially attached to a pharmacy, or maybe better said, it's a pharmacy that has a virtual direct-to-consumer virtual care product on it. And what I see happening is I think there's going to be a day of reckoning when we realize that perhaps we're not prescribing some of these pills or making the right diagnosis, and the incentive is just to sell pills, so to speak, right? I think the term now is becoming like these pill factories. And so who knows, in the next couple of years, there might be a bit of a reckoning on how well some of those disruptors have actually performed and what the appropriateness was of some of the recommendations they've made for patients.
I agree. And you're right. A big part of this is driven by companies that sell medications.
I'm sure you can guess the one I'm thinking about, but it's been in the news. I think they increased their revenue by 57%. The article came out this week. And then in the building that I live in Detroit, I've noticed now a third of the packages that are coming to the building are from this disruptor. And so they're doing well financially. It's just, is it really appropriate what they're prescribing? And I mean, you'd know better than I would as a physician. I think it remains to be seen.
Yeah, we can kind of fold that into a couple of themes from the book, Marschall. One of those themes was just how you successfully navigate disruption, right? So what I liked about the book, one of the many things was that you were able to kind of come up with a pattern or framework for navigating disruption and not just reacting to it. We talked a lot on the show about how even just basics of consumerism and consumer transformation, all of healthcare was reactive to it. It was treated as if it was something that was just thrust upon us and like, look, people have choices now. You have to react to it. Versus the institutions that are innovative, that have driven and been proactive towards addressing the fact that, yeah, guess what? Consumers do behave differently because everything around them's changing. What I really liked was that framework in the book of just how to navigate things. So there were, some of the things that were included in there, you did mention AI, but some of the new obesity drugs, virtual and behavioral health platforms, new payment models that are pretty new and interesting. They're pretty creative. Retail medicine, and then even on the scientific side, emerging gene and mRNA therapies, which in and of themselves, I rarely see this confluence of those types of topics all in the same place. And it led to this discussion in the book about the difference between successfully navigating these disruptions and struggling with them. How do you describe that, or what did you learn from the process of putting these trends together about the difference between institutions that are able to successfully navigate disruption and those that struggle with it?
I was at Becker's and talked to a number of different CEOs, and they range from saying, we have to be on the cutting edge. We have to be nimble and able to respond, which I believe, to other ones saying, this is a fad. I've seen fads before. And I think those healthcare providers and those healthcare insurers are going to have a tough time. And you mentioned the obesity drugs, the GLP-1 agonists that like Zepbound and Ozempic and Wegovy. Those drugs are truly transformational. And it's because there are neural set points that are just different in people. And you both look slender and healthy, and maybe you're incredibly disciplined, but maybe also it's that when you have a meal, you feel satiated and you don't need to have another meal. There are people who, and the genetics of this is just now becoming understood, who they don't make enough of this peptide called GLP-1. And so they never get satiated. And these drugs can be, not everybody in the world needs these, but with obesity now approaching 50% in the United States, we need to do something because that huge group of people, large group of people, they're going to develop type 2 diabetes. They're going to develop all the complications of diabetes. And so I think that's an example of, well, how do we get them the medications they need at an affordable price? Because right now, the GLP-1 agonists are quite expensive. I do talk in the book about there's some areas in which I'd like to see the federal government flex its muscles. And one is in purchasing power. So, if the federal government decided they wanted to go to one of the companies making one of these medications and say, well, we'll guarantee you $15 billion in sales, the price would drop dramatically. And I've talked to CEOs at big pharma companies. So we need to be able to pull all the levers we can to enable our patients and our providers to take advantage of the technology that's around. I also talked a little bit about Mark Cuban's pharmacy. It's plus 15%. No other pharmacies are plus 15%. The margin is much higher. And there are many, many middlemen along the way that take out a share of that. His is direct to consumer. And I think that's a direction that we'll see a lot of big pharma going into. So I think you asked me about or commented on how I felt optimistic. I feel optimistic because I think we live in an incredibly ingenious country and once identified that we need to figure out how to help people be healthier and be able to provide their care at a reasonable cost. I think smart people are going to come up with solutions. That's why I'm optimistic.
All right, Marschall, we like to wrap just asking about if you had a message for health consumers, especially those who are looking to navigate some of either the disruptions or their own journeys that they're experiencing. Some of the things you just mentioned are part of people's individual health and wellness journeys every day, and it's not easy to navigate a lot of the time. So if you could share one message with health consumers, what would that be?
Well, the message is take charge of your health. And that's an easy thing to say and a hard thing to implement. So what does that mean? Well, it means finding what I'll call a medical home. And a medical home is a kind of clinical organization in which when you go there, you might see a doctor, you might see an advanced practice nurse, you might see a social worker, you might see a dentist, you might see a pharmacist, that they can provide all that in a unified system. And they're out there. And I think the more we support those and the more appetite there is for that, the more of that there will be in the United States. And so look for a place that fits your needs. Take control of your health. And so if your needs are, you like things right away, you like to do your transactions online, find a place that does that. If you want to be seen in person and understood, find a place that does that. Because all those options are out there and they're all trying to serve everybody. But I think the consumer, and I do think we live in a consumer world, the consumer needs to find what fits best for them. And if they are very accepting of technology like AI, find a place that uses AI. AI is a fabulous tool. And there are now practices that use AI. And the scare among healthcare providers has been, they're going to replace all of us. It's not going to replace all of them. We have an unquenchable thirst for healthcare. But what it can do is extend them and help them make their patients better when they're having a medical problem.
The book is The Great Healthcare Disruption. It's been our pleasure to have Dr. Marschall Runge with us. Thanks so much for joining us today.
Thank you both. It's a privilege to be on your show.